Greetings everyone, Jeff Bourgeois with San Juan Regional Medical Center here with you today to provide an update on what's going on around our state as well as here locally at San Juan Regional Medical Center with our COVID-19 response. First and foremost, I always want to remind you to take advantage of the resources we have available on our public website at sanjuanregional.com. There's a dedicated COVID-19 section to our website that provides up-to-date statistics, state information, as well as some relevant information to our visitation policy and other practices within San Juan Regional as a result of COVID-19. From a statewide basis, we've seen some improvement in the overall statewide spread of COVID-19. The current week's reading says 1.10 compared to 1.2 from the prior week. The state originally set a target of 1.15 for certain phases of reopening. Our next trigger is 1.05, so you can see that we're not quite there on a statewide basis at 1.1. A little good news for the northwest region of our state continues to be that we have the lowest R effective rate of any region in the state. Ours this week is 0.9. That's up a little bit from last week's 0.8, and we're watching that closely and hope we can continue to be less than 1. That's a key trigger for many metrics relative to pandemic control. This next slide shows kind of a trend of growth rate over time for each of the various counties. Each of the various regions. Our region is the red line, the northwest region, and again, on the far right-hand side of the graph, you'll see that we are the lowest in the state, and we're right at that 0.9. So what's going on at San Juan Regional Medical Center? Well, today, this morning, Friday, July 17th, 2020, we have a total inpatient census of 131. We have 28 confirmed COVID positive patients in-house. 5 additional patients under investigation. 5 of our 28 patients are intubated. So to date, that brings us to a total of 459 COVID patients we have served at San Juan Regional Medical Center since our very first admission, dating all the way back to March. We've discharged 363 of those. We are rapidly approaching the 400 patient discharge mark. That's a milestone we will certainly celebrate with our patients as well as our staff for their tremendous response to this COVID-19 pandemic. We have had, unfortunately, 68 deaths of hospitalized patients at San Juan Regional Medical Center, specifically due to COVID-19. And as I mentioned earlier, still have 28 patients in-house. The trend data for our census is now displayed on this graph. The top blue line is our overall inpatient census on a daily basis. The 3 lines at the bottom represent, in the red, our patients under investigation. In the green, the confirmed COVID-19 positive patients. The purple line represents the combination of the green and red lines, if you will. So that's our total COVID census, total COVID census on our COVID floor. So I'd like to just go over a few points in summary to talk about some things we feel are important for our community to keep in front of you. While the COVID-19 transmission rate has spread recently in our state, our region still has the lowest rate of spread. However, COVID-19 is still very prevalent in our state as well as our region. We need to continue to be vigilant and do everything we can as individuals and as a community to mitigate the spread of the disease. There are still, as of this morning, 170 patients hospitalized throughout the state with a COVID-19 positive diagnosis. So the disease is still very active in our state. Our San Juan Health Partner Clinics have reopened for in-person visits, while encouraging virtual visits whenever possible. If you feel you have a need and really need to see your provider in person, please contact the clinic to make arrangements. We are opening our surgical, procedural, and outpatient diagnostic schedules in accordance with Department of Health rules, and we are using COVID-safe practices in each of those venues. Again, please contact your physician offices to schedule procedures as needed. I mentioned earlier that COVID-19 has a very significant presence in our community still. We cannot lose sight of that. Therefore, really want to encourage you just to do the things that have been proven to slow the rate of spread. Wash your hands, wear a mask when in public, and practice social distancing. A couple of things we also want to remind you about is if you do need to arrive to any San Juan Regional Medical Center for an appointment or procedure, come a few minutes early to allow us to complete the COVID-19 screening process. That's part of what we do to keep you, patients, safe as well as our staff. We still have some visitor restriction procedures in place. We are allowing one visitor per patient on our non-COVID floors. However, those patients need to be screened. They will need to wear a mask while in the hospital. And we want to encourage virtual visitations whenever possible. Use Facebook, Zoom, or look on our website at sanjuanregional.com for how to send an e-greeting to a patient. We've had literally dozens of family members take advantage of those, and it's something that I think patients appreciate as well, and there's no limit on those. That's the good news. So thank you very much for your time today. Thank you most importantly for your support of San Juan Regional Medical Center. And finally, thank you for your support of COVID-safe practices. Wear a mask, wash your hands frequently, and practice social distancing. Thank you and have a wonderful day.